I really thought that the military health system would let me be the type of primary care doctor I really wanted to be and have more time with patients. But unfortunately, every year it got worse and more like the civilian insurance based model. I noticed some female doctors that I say as many times as
Mm-hmm.
needed rather than as much as you
Yep.
want.
Amy Walsh, she says, you're not an all you can eat
Yeah.
doctor buffet. Just because you have insurance doesn't mean you have health care. Because remember when you called your doctor
Yes.
and you couldn't get in, you still have insurance. Oh, and then the insurance, even if you have insurance, what does it get you? Welcome to DPC Life, the podcast where independent doctors share real stories, bold ideas, and the freedom of doing medicine on your own terms. I'm your host, Dr. Ann Gonzalez, and together we'll explore the wins, the struggles, and everything in between. Let's dive in. So today I have with me Dr. Jaclyn Harris of Desert DPC, and she just opened last week. So this is super exciting. And Dr. Harris, please tell us more about how you found DPC and what brought you to it.
Yes. So I was working in the military health system as an internal medicine physician. I really thought that the military health system would let me be the type of primary care doctor I really wanted to be and have more time with patients and really get to know them and keep them out of the hospital, keep them out of the specialists' offices. But unfortunately, every year it got worse and more like the civilian insurance based model. We were having to refer patients for everything, and it drove me nuts. I felt like I was way overqualified for one thing. So it made sense that the military was replacing primary care physicians with nurse practitioners and PAs because we couldn't really do what we were trained to do. So I knew that I wanted to stay in the outpatient setting. I love primary care much more than the hospitalist role. I did that for many years in the military as well. So I needed a model of care where I could be the type of doctor I wanted to be. And I wasn't going to find that in the military. And I knew I was not going to find that in the corporate
Yeah,
based healthcare
yeah,
systems outside of the
true,
military.
very true. And you are boarded in internal medicine and is it obesity medicine?
Obesity
Okay,
medicine.
great. Actually, that's the same combination that my partner, she's also internal medicine and obesity medicine. So, yes,
Oh, very good.
it's a great combo. It really is. Okay, so you opened your DPC last week. And so, how long did you plan from like thinking, okay, I'm going to do this? Like, how long did it take you?
I think I found the another DPC podcast in
Mm-hmm.
2022. And that really, I listened to that podcast on my drive to work and drive home from work
Mm-hmm.
every day to get me through my last couple of
Mm-hmm.
years of my Air Force commitment. So I had made up my mind in 2022, I think, that I
Yeah.
was going to open my own direct primary care clinic. It took a little bit longer to get my husband on board. He is an entrepreneur and owns his own business with his sisters. So I saw the entrepreneur life and I saw how freeing it was and how happy my husband and my sister-in-laws were to have control over their future and over their business. But my husband was like, Jaclyn, you do not understand what all is entailed. There's just a lot of moving parts all at once. You're going to have to be a business person in addition. Are you really sure you want to do that? And I said, yes, it is worth it. And then I brought him to the DPC Summit Conference. I think that was in early 2020. We attended together and meeting all of the physicians there who were so satisfied in their careers really got him on
Mm-hmm.
board instantly. He could see why I
Mm-hmm.
wanted to do this.
Oh, yeah.
So that was great. So once he was on board, he was like filing for my
Wow.
LLC and trademarking my name
Ooh,
and
yeah.
reserving a website
Look at
domain.
that.
He was doing some of those foundational things for me, which was such a help.
Mm-hmm.
And I remained in the military until June of 2024. So I was dreaming about Desert DPC and coming up with a name and such, but I was still working in Florida in the military, and we knew we wanted to move home to Arizona to set up this practice. So we could only do so much from across the country. And then when I got out of the military and moved back home to Arizona in July of 2024, I thought I would open up right away, but instead I got pregnant and decided I didn't want to have a baby and open a practice at the same exact time. So I did telemedicine the past year just to kind of take it easier and, keep brainstorming for my primary care practice. And finally we are opening. So it feels like a long time in the coming, in the
That's
making.
amazing. Wow. Yeah. And it's great being a primary care doctor that you had the option for telemedicine as you had your
Yes,
baby and baby was still little. So that's great. Wonderful. Well,
absolutely.
you're so lucky to have an entrepreneur husband who understands
Yes.
and can help you. That's great.
Oh, yes, it is huge. I feel like the success that we've had here in the first week is really because of him and him kind of helping me keep costs under control and so that we could easily cover our monthly operating costs.
Yeah. Yeah, so great. You have a leg up on most DPC doctors with that, business side. So, well, thank you for coming on and talking with me about your DPC and then also being willing to do a little bit of coaching. Tell me what kind of things you wanted to talk about and then also when we finish this session, what would be success for you for this mini coaching session?
Yeah, I feel like I probably need to nail down my elevator pitch. I've been doing virtual meet and greets with all of my prospective patients, which has been great because they've already been to my website or onto my social media platforms. So they know it's a membership model. So I can really let them do the talking about what their frustrations are with the current healthcare system, why they're looking for a new primary care doctor, why they found me, and go from there. But for people I just meet out and about who have never heard of direct primary care, I don't have a great way of quickly describing it and how wonderful it is without going on tangents about how terrible the insurance-based system is.
Yeah. Well, then, what do you feel is kind of the thing that makes your practice different that you want to highlight to people?
Yes. So what I've been trying to highlight is physician-led care for one thing. Most of the concierge or direct pay practices in my community are owned and operated by nurse practitioners. So I try to drop in the physician-led there. I also like to highlight that it's affordable because the other direct pay or concierge primary care practices in my community are really located in Scottsdale, Arizona, which is the most affluent area, and they charge a lot, and it's just really out of the price range for most people who don't live in that zip code.
So, how much are you charging, and then what are
Yes.
they charging?
Yeah, so they charge more like $300 a month, and I charge $100 a month for adults 18 to 64 and 125 for adults
Okay.
65 and up.
Okay. So, the affordability and also the fact that you're a physician, those are the two things that you want to highlight.
Yes.
Now, when you've talked to your meet and greet patients, what have you found they're looking for? What are their pain points?
Yes. So a lot of them are coming to me saying, I really love my doctor. I did a lot of research to find them and they had great reviews, but I can never get in to see them. I could only see whatever nurse practitioner has an opening, and I'm always seeing a different one, and I really just want to see my doctor, but they're too busy for me. So I have those. And then I also have people coming from other direct primary care practices or concierge practices who say that their membership got to it. So some of these are nurse practitioner owned, or they are more corporate concierge owned. And they said it's just gotten too expensive. It started off more affordable and then the prices go up every 6 months or so.
Okay. How many of the people that you've talked to, your meet and greets, are those coming from other DPCs? What percentage would you say?
Like
So a
15%.
small percentage. Yeah.
Small percent,
So the
yes.
majority. Oh,
Oh, and other people are coming for me specifically for help with weight
okay.
loss. They know that I offer a full primary care membership, but I also offer a weight loss only membership for $75 a month. I figure that weight loss medicine is easier than full primary care, so it should be priced less. So people are finding me just for help because their primary care physician doesn't prescribe weight loss medicines or isn't comfortable
Mm-hmm.
with them. And I hope that eventually I will be their primary care
Right.
doctor
Yeah.
as well.
Yeah. So 85% of the people that you've talked about, talked with, are talking more about the issue of not getting in to be able to see their doctor
Yes,
or seeing someone different every time. So that sounds like
yes,
more of a pain point than the issue of cost.
sure.
Yeah.
That's true.
Yes, it's important to be a physician led practice and it's important to be affordable. But what they're thinking about is, I can't get in. And so they're not focused on that. They're focused
Yeah,
on, I can't I can't see my doctor.
yeah, that's a
Yeah.
good point.
So it's not that your points aren't important. It's just when you're talking to somebody and you're trying to get them
Mm-hmm,
to see what your value is, they need to see your value for what they need, right? And what they're really
mm-hmm.
looking for, what's really bugging them. So I would suggest crafting your elevator pitch to that, because that, it sounds like more people are going to resonate with that as opposed to the cost. And there's always going to be some who are going
Yeah,
to, just like that 15%. But
yeah,
if you're trying to reach more people, then, that might be a better way to kind of talk with them about it.
yeah, that's a good point. I guess I have struggled with that because I've been warned by many female direct primary care physicians not to use the term
Yeah, no.
24/7, to really put some good boundaries there. And I haven't been saying 24/7, but I guess I don't know quite how to phrase increased accessibility. I mean, right now I have tons of
Yeah, yeah.
accessibility because I just
Mm-hmm,
opened, so I don't have a ton of patients, but how to phrase that promise
mm-hmm,
to them that I will never be too
mm-hmm,
busy for
mm-hmm.
them.
Well, it's hard to say never.
Sure.
That's probably not a good word to use. But what is your vision? What do you feel like you're willing to give to your patients as far as accessibility? And this is where you have to think about, you want to start the way you want to finish, because you
Yes.
don't want to give so much and make yourself so accessible that when you do get busier, you can't. Not that you don't want to, you
Yeah.
just can't. There's only one of you and only so many hours in the day. Yeah. So,
Yes.
what do you feel like? Okay, I think this is a reasonable place for me to be. And envision yourself like how many, with 200 patients. When you have that many, what do you want to be doing?
Right. So I know that I want to offer my patients a variety of times that they can see me. It really bothered me in my employed position in the military health system how we only did new patient appointments at 9 o'clock and 1 o'clock. And if you didn't have availability right then, we weren't going to see you, or we only did annual appointments at 10 and 2. And I hated that. So flexibility is big to me. So what I have done, but I haven't really advertised yet, how I've set up my working hours in my electronic medical record is I block off time Monday, Wednesdays, and Fridays to take my son to preschool and pick him up. And then so I just have a small working window in the morning when Monday, Wednesdays, Fridays, because he only goes to school on those days. And then I have a longer block Monday afternoon down to 6 p.m. because I figure that way, if Mondays can be busy, that would be convenient for folks to drop in after work if they need to. And then Tuesdays and Thursdays, I set up some earlier hours to open as early as 7 to catch some people before work if they want to. And then Wednesdays, I've set up as just telemedicine day because I would love to work from home on Wednesdays if possible and not work very much. And then Fridays have more of a 9 to 5 schedule. So I'm mixing it up, but I don't really want to advertise those hours in case it changes as, my
Sure.
kid's school schedule
Yeah.
changes.
Yeah. Well, you're the boss, so you can
Right.
absolutely change. And you don't need
Mm-hmm.
your patient's permission to change. You don't need
Right.
anyone's permission
Mm-hmm.
because it's your business, right?
Yeah. Yeah, that's good.
So, and it's hard for us because what you're doing, you've got a 5-day week there. You're seeing patients 5 days a week in this schedule. So your husband will also probably point this out. When are you going to work on your business?
Yeah, I just figured that I kind of would work in between appointments, if I have downtime. Maybe that's not a good
Yeah.
plan.
Well, so you came from fee for service medicine, which I did too. And you never see anyone working on the business because you never did it.
Right.
But you have to. You have to plan some
Okay.
admin time because
Mm-hmm.
you're just going to need it. You're and depending on how many patients you want to have, and you don't have to work 40 hours a week seeing patients because it's DPC.
Right.
I would think, okay, imagine your kids are 10 and 12. I mean, I can't remember how many years between, but you know, baseball or soccer or whatever, you're going to need time for that, right? And
Yep.
honestly, it's easier to add time than to take it back, like hours of
Mm.
availability.
Yes.
So your patients are really going to appreciate that you're actually really available. Even if you limit,
Mm-hmm.
the number of hours that you're seeing them, even if you're not 40 hours a week or
Sure.
whatever that number of hours went,
Mm-hmm.
because they'll be able to call, leave messages. They'll be able to, I don't know, do you have a portal or are you playing on text or how are you going to do that?
Yes, I have Sigma
Mm-hmm.
MD as my EHR, and it's set up to where the patient portal is like an app on their phone that they can
Mm-hmm.
directly text
Mm-hmm.
me, and it feels
Yeah.
like texting
Okay.
each
And then
other.
that will go to you. So, they have direct
Mm-hmm.
access to you that way as well.
Mm-hmm.
And you'll find that with that access, that kind of access, and you can do a lot on the portal, you won't need to see them in the office sometimes. You can kind of take care of things either by phone or by the portal. Of course, there's going to be times when you need them to come in.
Sure.
Sometimes you don't. Like you can do a telehealth and be like, that's shingles. Okay, let's do this. You don't
Right.
have to come in. I would start thinking about what about when they are older? What kind of schedule would you like? Like I said, you want to start how you want to finish because you don't
Okay.
want your patients to get so used to this. Well, I can come in at 7 a.m. one day, and well, what if you have to take your kids to school now? And when they get
Yeah.
older and you can't do that, and then they're mad
Yeah.
because they never had. Which it is a hard balance because I understand you do want to serve your patients, but you also think about those boundaries. Yeah.
Mm-hmm.
So that's why you
Yeah.
want to never say, this is a one never. Never say 24/7. Dr. Amy
Yes.
Walsh, she says, you are not a doctor buffet. You're not an all you can
Yeah.
eat doctor buffet, right? The kind of care that you're going to provide is so much better than what your patients had in fee for service that
Mm-hmm.
just you want to give, but you don't want to give too much. And it sounds terrible that way, but
Okay.
it's also to protect you and your family, your
Yeah.
time.
No, that
Yeah.
makes sense.
So, one thing that you did want to offer, though, you wanted to offer that flexibility for your patients, right?
Mm-hmm.
And so they are saying they can't get in with their doctor. So, how can you highlight how your practice is better? I'll give you one way that
Mm-hmm.
I was taught when I was starting out with this. It's kind of a formula that I think a lot of people who are in business will use when they're trying to explain what they do. It's a couple of parts. So the first part is how blank. You know how when you call your doctor's office, you can never see your doctor. Or you can never get an appointment when you have a cold, for example. Or you'll end up seeing somebody else that you've never seen before. And then you have to wait in the waiting room and all that. Well, so it's how when you blankety blank. What I do is we have a practice where you can call, you can text, or you will always be able to see me same day or next day. Trying to highlight those things. I can see you earlier or later, but highlighting that you're accessible,
Yes.
not 24/7, but that they'll get to see you.
Mm-hmm.
Yeah.
Yes.
So if that's one thing that they're concerned about the getting in and when they need to get in or they really want to get in, that they can be seen.
Okay. I
Yeah,
like that.
so
You know how. That's perfect.
other things that you want to figure out is how do you explain the model? Trying to explain it in a very short and yet understandable way. If you have your, how, blankety blank, right? Then you're
Mm-hmm.
going to go into my practice is a direct primary care. Oh, what is that?
Yeah. So far, I've been explaining the direct primary care model. I say that my practice is a direct primary care clinic, which is the model in which the clinic does not bill insurance for the doctor's time and expertise, but rather patients pay a low monthly membership. And then some people still will say, well, but do you take my insurance? And I say, I can see patients with any insurance or no insurance at all because I don't bill insurance for my time, but rather my time with patients is all covered by the low monthly membership fee.
Yeah, perfect.
So far, that's worked, I
Yeah, no,
think.
that's great. Yeah, you're right. You don't want to say no. You want to just kind of flip it around and say, yeah, we can see anyone.
So far, yes.
So, one thing that you said is you can be seen as many times that you like unlimited time. Again, you're
Yes, I noticed some female doctors that I like say as many times as needed rather than as much as you
yep.
want.
Yes.
Yes, because I know that there are some, I've already opted out of Medicare, and I know there are some older people who get kind of lonely and want to book a lot of appointments, and we don't necessarily need all those in-person appointments. So that's why I'm trying to use the word
Good.
need.
Yeah. Yeah, that's true. So, other people will describe it like Netflix, that monthly recurring, or a gym. The gym is my favorite one because it's kind of funny because everyone has had a gym membership at some point where they pay for months and never go, right? I certainly have. So that one is like if you go to the gym and you go many times, that's great. But if you don't go, you're still paying. And but we're there for you when you need us.
Yes, I've used that line, but we're there for you if you
Yeah.
need us.
Yeah. So, okay, what about like when people start asking, well, why? This is always what they ask. Why would I pay you more when I have insurance?
I haven't gotten that direct question yet, but I know it's coming.
Yeah.
I would probably try to flip it as best as possible and say, well, unfortunately, health insurance these days does not cover primary care very well. And most of us have a pretty high deductible where we're still paying for our first few visits out of pocket. And that disincentivizes a lot of people from going to the doctor and having great preventive care. And, and I don't know,
Mm-hmm.
something about trying to achieve health or staying
Mm-hmm.
healthy before they
Mm-hmm.
get sick. I don't know. I probably would need to flip
Mm-hmm.
it. Something like that.
Yeah. It's a common question. Why would I pay you more when I already have insurance? So one easy thing that you can say is it's a slogan, I guess, really is, well, just because you have insurance doesn't mean you have health care. Because remember when you called your doctor
Yes.
and you couldn't get in, you still have insurance. What did it get you? Right?
Yes.
And people are so married to their insurance, but they start to see when you bring up that point, like, you have insurance, but you still paid copays. I mean,
Right.
you're going, if you see a specialist, $50 or $100 now. So You have insurance.
Yeah,
Yeah. Yeah.
good point. And I think a lot of patients see that when they get their bill from LabCorp or
Uh-huh.
Quest that insurance doesn't actually pay for any of the labs.
Right.
Like, they just negotiate
Mm-hmm.
down the
Yep.
price.
And then that's another thing you can say. You can bring up, you know, how when you get a bill from LabCorp for your labs,
Mhm.
but you haven't met your deductible yet, how much they cost. Like annual
Mhm.
labs would be $200 maybe. I don't know, but it's a lot. It's significant. And
Yes.
so, do you have a contract with LabCorp? Or are you?
The LabCorp is in the
Mm-hmm.
works, but I do have a
Okay.
Quest
Yeah.
contract.
Other like common things that people would say. A lot of times they'll say, "Well, isn't this concierge?" And yes, it's not. But sometimes people don't understand unless you describe it as concierge. But because you want to explain about the affordability, how would you address that? Isn't this on concierge and for rich people?
Yes. So originally, a couple years ago, I was explaining that direct primary care is like concierge care, but for normal people who aren't the rich and famous. But then hanging out in the DPC circles, a lot of them like to distinguish that concierge models tend to bill insurance for visits as well. And in which case, the membership is more of a retainer to have access to that doctor. So I actually have a tagline on my website that says concierge quality medicine at an
Mm-hmm.
affordable price. So I'm trying to explain that it really is concierge medicine, but just in a less fancy setting so I can make
Mm-hmm.
it
Yeah,
affordable.
I saw that. I love that concierge medicine
Thank you.
at a more affordable price. Yeah, that's a really nice way to describe it because there are similarities, certainly. Absolutely. You know, smaller patient panels, more
Yeah.
time, more personalized
Yes.
care, obviously. Yes, there are a lot of similarities, but yeah, the big difference is the cost.
Great.
Yeah. What other questions have people gotten given you, asked you that you were kind of like, I don't know what to say to that.
Everyone wants to know about using their HSA.
Oh, yeah,
And luckily, I'm coming
you
in at a good
are.
time. And I say the federal government just ruled that HSAs can be used to pay for direct primary care membership, that it's not debatable
Mm-hmm.
anymore. So I've been telling patients that they can put in their HSA credit card just like another credit card on my billing
Mm-hmm.
platform and to let me know if their HSA provider has any issues with that too.
Mm-hmm. Yeah. Yeah. Now, what about employers? Are you trying to reach out to employers? Is that something you want?
I would love to. I did just barely tiptoe into a Facebook group of local small business owners and said, "Hey, I just opened a practice in the area." And described it a little bit. If you're looking for a doctor or if you want to offer membership to your employees, please let me know. So I'm not going hard after employers yet. And part of that is the 24/7 issue. Hint Connect, in order to work with them, you have to have in your patient contract 24/7 availability, or at least access to you for phone calls and such. So I'm a little nervous that I have to use that verbiage if I talk to
Mm-hmm.
employers, which is probably not the case if I'm working directly with
Mm-hmm.
the
I
employers.
mean, I think 24/7 availability is vague. You could
Yeah.
interpret it as you can message me anytime. That's 24/7.
I feel a little uneasy going after employers because I can't see kids. As an internist, I don't see kids. I do hope in the future to expand to be a med peds practice. I would love to partner up with some
Mm-hmm.
pediatricians so we can take care of the whole
Mm-hmm.
family. In my husband's line of work, he knows a lot of small businesses whose employees all have grown children and it wouldn't be
Oh,
an
yeah.
issue. So I really should, try to go
Mm-hmm.
after employers and put it out there and see if any of
Mm-hmm.
them are
Yeah.
interested.
So is your husband willing to put those feelers out for you? And
Oh, yeah. He's always talking about
oh, good for
DPC.
him. That's amazing.
Is a social butterfly, completely extroverted. loves networking, and he's just polar
Mm-hmm.
opposite of me. And
It's
it is
hard. It
wonderful.
really is hard to, especially for introverts to like, when people are asking you these questions and you have to go and talk and you have to initiate it. That's why doing something like this and just like practicing, you just have to practice it. Just talk to,
Yes.
honestly, it's nice to record yourself because you
Mm,
sound completely different. Just the way you just don't even realize like all the filler words and so
yes, I've noticed that trying to make some social media videos. I'm like, oh, I hate hearing myself talk.
yeah, it's hard to get used to, but you do get used to it. And then it's just kind of second nature, but listening to the way you talk and then especially if you're going to be doing videos and then recording a video and then watching yourself, just not really listening
Mhm.
but just watching to see if you have any
Yes,
particular movements or is there something like are you always touching your nose or just there's always something and
yes.
it will make you really aware of are just like that, are you saying or like or things like that. What do you say a lot?
Hmm.
And it's not that you have to get rid of that all completely, but I think people, when they're kind of struggling to find the words, they will do a lot of the ums and and that's how you'll pick it up. But I think you've got some good things to like work on for your elevator pitch.
Yes.
Yeah. So you've got kind of three parts, right? So the first part is when, blah, blah, blah.
You know when?
And
Hmm.
then also accessibility again. Oh, and then the insurance. Even if you have insurance, what does it get you? So those are kind of the three big things I think people tend to want to know. So that'll get you pretty far. Yeah.
Perfect.
Well, I hope that helped you.
It did. Thank you
Oh,
so
you're so
much.
welcome.
Perfect. Yes, you've given me so much to think about
Oh,
and work
good.
on yeah, to really get this
Yeah.
down.
Yeah, good. And then also, I think thinking about your schedule, because that's a
Yeah,
hard one.
that's a good point.
It's a hard one. And as you get busier, you'll find that you will need admin time because when are you going to call people
Hmm.
back? What if people are
Yes,
calling and asking about what is DPC? You can answer those questions right now, but
right.
systems, I think it looks like you have good systems though. I saw your post about looking at the data of the people that, what
Yes. So, yes, since my husband works in, he has a franchise that sells services to other small business owners, so like phone
Mhm.
answering and executive offices and conference rooms and such. So he is used to using
Mhm.
CRMs to manage his leads and his contacts. So he was adamant, we are using a CRM
Yes.
for Desert
Yeah,
DPC. And I think a lot of
they don't.
DPCs don't, because when I asked that all the EMRs, when I did all of my demo calls, I asked if they integrated with any CRMs and they like laughed at me. They're like, no, why would we do that?
Yeah.
But yes, the CRM has really kept us organized and able to create some workflows and get some data and have some automatic steps. If they sign the membership agreement, then they automatically get an email to enroll. If they do this, then they get this
Mhm.
email and such. So that has been great.
Yeah.
And my husband has helped tremendously in setting all of that
I'm
up.
curious, what CRM are you using?
We're using Zoho
Okay.
One.
Yeah.
Yeah, he likes the Zoho products the best. I started on Zoho Begin, but we kind of outgrew it like immediately. And Zoho One just had more
Mhm. Mhm.
functionality.
Yeah. So I just started a couple months ago because yeah, we did not have a CRM. We didn't have a real CRM. We were using Google Sheets. That is not very functional, but that's what we had. So we started using High Level, and so we've been able to make it just for DPC, and you can do all the automate. That's the automation save you so much time, so much time.
Absolutely. We're not asking a ton of questions right now. We're asking, like, how did you hear about us? Age, and are you interested in full primary care or weight loss only? Just collecting some of that information. that is really helpful.
Yeah. Well, I think you're doing fantastic. All of your
Thank you.
website looks beautiful. You're doing your social media. Yeah.
Thank you. And thank you for
Yeah,
the
sure.
coaching.
All right. Well, I look forward to seeing what you do. And yeah, maybe we'll talk again in 6 months, kind of see where you are. Thanks for listening to DPC Life. If this episode got you thinking about the system side of DPC, don't just let that sit. Head to harmonyopsfordpc.com to see how we can help you automate your practice, or start with the free DPC Confidence course to build a solid foundation before you even open your doors. This episode is sponsored by Harmony Ops for DPC, helping doctors plan their practice before they leave the system. Thanks for joining me, and remember, your DPC family's got your back.